Vocal Fremitus. Tactile vocal fremitus is the tactile perception of vibrations communicated to the chest wall from the larynx via the bronchi and lungs during the act of phonation. Mechanism: sound vibrations produced in the larynx during phonation are transmitted to the bronchi and lungs and then communicated to the chest wall. Transmission of spoken tones depends on the state of the underlying lung parenchyma in the pleural space. Normal lung parenchyma is a mixture of air-filled spaces and solid lung parenchyma. Air is a poor conductor of low sound frequencies, whereas a solid or dense medium increases the transmission of low sound frequencies. Examination: before palpating the posterior chest, ask the patient to fold his or her arms across the chest wall to displace both scapulae. Ask the patient to repeat 99 or 1, 2, 3 in a constant tone. Palpate the chest wall on both sides, using the ulnar border of the hand or the palmar base. Palpation begins with the lung apex and moves to the same location, on the opposite side of the chest wall. The perceived vibrations on both sides are compared, while moving hands from the apex to the base of the lung, covering the entire posterior chest wall. Repeat the same maneuver on the anterior and lateral chest walls. Interpretation: an increase in vocal fremitus indicates denser lung tissue, which can be caused by consolidation. A decrease in vocal fremitus suggests air or fluid in the pleural spaces, or a decrease in lung tissue density. Tactile vocal fremitus is increased in consolidation, which may be due to pyogenic or tuberculous infections, following pulmonary infarction, pulmonary malignancy, or when there is a large superficial cavity. Tactile vocal fremitus is decreased in pleural effusion, pneumothorax, hydropneumothorax, bronchial obstruction, emphysema, pulmonary fibrosis, and pulmonary collapse. Other vibrations: pleural friction rub occurs, initially in pleurisy, due to rubbing of the two pleural surfaces. It is usually felt at the peak of inspiration or early expiration. Bronchial fremitus occurs in bronchitis, bronchial asthma, and chronic obstructive lung disease. Palpable rales occurs in bronchiectasis, pulmonary fibrosis, and pulmonary congestion. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED, the easiest and fastest way to take advanced clinical history.